Well, kids are now back in the swing of the school year, but some may still have a little trouble paying attention, and that could be the sign of something a little more serious. Gunderson pediatrician Dr. Anna Jackson is here with us on this Medical Monday discussing ADHD Awareness Month. Dr. Jackson, thanks for being here.
Good morning. Thanks for having me.
So when does this, let's get right to it. When does this become something more than just, they have some trouble paying attention, they may be a little hyper? When does it become ADHD itself?
So when it actually is ADHD, it can cause a lot of problems with daily functioning at home, at school, and hanging out with friends.
And some of the symptoms lead us to see that there are actually 3 different types of ADHD. What are they?
Correct. There's 3 main symptom clusters. One is inattention, or the inability to stay focused or follow through on a task. Hyperactivity, or persistent motor movement, the need to talk excessively, get out of your seat. And impulsiveness, or the tendency to act before thinking, blurting out, interrupting. And so those 3 symptom clusters lead to the inattentive form of ADHD, the hyperactive type, and then also the combined presentation where you have symptoms of both of the other 2 types.
Okay, and I understand this can be genetic too, so it's not necessarily based on any parenting or a child's behavior growing up.
Correct. The exact cause of ADHD is still not entirely clear, but genetics definitely plays an important role. So it does tend to run in families. And you're right, things like eating too much sugar, watching too much TV, or parenting does not cause ADHD. Okay, so good things to know. We talked about the differences between that just hyperactivity, hyper behavior, and what ADHD actually is. Real quick, we're running out of time. When is it important to go to the doctor and ask whether this is actually ADHD? So if your child is having these symptoms and it's causing problems with schoolwork, completing assignments, following rules at home, then you should definitely contact your primary care provider, or the pediatricians at Gunderson are happy to see them as well. All
right, some things to keep in mind. Dr. Anna Jackson, we thank you for being with us on this Monday morning.
Thank you.
All right, it's 11 minutes before 7 o'clock right now, and we'll be right back with the check of your day planner outlook coming up next.